So today we continue with our research strategy section, and in fact we arrived to the last two sections. I hope everyone can see my screen right now. So let me open it up. There we go. So the two remaining sections of the research strategy that we will be covering today are the innovation section and also the section on the future directions. So during the first part of today's pedagogical lecture, I will cover innovation section and Mary Kay will cover the future directions, and then we're going to go into the breakout sections. So just to remind you all, with respect to the overall layout of the sections of the proposal, innovation is this, strictly speaking, innovation is the second part of the research strategy. It goes immediately after significance, and this is the section that we're discussing right now with you. So with respect to the NIH specific guidelines for writing the innovation section, which I've borrowed from the NIH website, NIH is very explicit about what should go into the innovation section. So we as writers don't really have to guess. What NIH says is we need to explain how the application challenges and seeks to shift the current research or clinical practice paradigm. So this is pretty ambitious statement, but NIH provides some additional clarification with respect to how paradigm changing our proposed research should really be. So they also say that here in this section, we're describing any new theoretical concepts, approaches, or methods or instrumentation that we will be developing or using over the previously developed or employed existing methodologies, instrumentations, or interventions. So again, in case of your proposal is not exactly is related with the mission of the NIH, you would still be explaining the same things, except that these would not be necessarily in the context of the healthcare. We also explain any refinements, improvements, or new applications of theoretical concepts, approaches, and so on and so forth. So in this innovation section, we do both. We describe the change of the paradigm, but we also describe any refinements or improvements which in HIs contribute to the innovation. So all in all, what we are doing during this innovation section, we need to convince the reviewers that our proposal is truly innovative, again, based on the definition of the NIH, in order to maximize the odds of getting your proposal funded. So on this slide, I provide more detail of really what NIH is expecting us to put in the innovative section. So if you are either a new PI or entering a new idea, be cautious about seemingly being too innovative. So again, if you're a new PI, don't claim that you can cure cancer. This is just far-fetched example. So keep in mind that innovation is one of the 5 key criteria during the grant review sections. So despite of the fact that the section, as I will be discussing a little bit later, is very short, yet innovation is like, it's 1/5 of the, entire criteria. So put a good effort to describe your innovation. A reviewer, so in case if you're describing how a paradigm changing your particular grant proposal is, a reviewer may take a challenge with the status quo that you're describing with respect to his or her worldview. So when you're describing the innovation of your proposal and how innovative your proposal is with respect to, changing the treatment for a certain disease or developing innovative material, again, be careful with the fact that you need to back your statements. When you look at our simple applications, as NIH says, you will see that both new and experienced investigators are not generally shifting the paradigms. Effectively, they're using new approaches, new models, or working in the new areas or testing innovative ideas. So what NIH tells us is the vast majority of the NIH applications, they're not really super groundbreaking. These are innovative in one of these areas by either developing new tools or new methods. So when you finish the draft application, draft of the innovation section, what NIH tells us is what you should be checking for the content of your innovation section. So what you should ask yourself, I show how my proposed research is new and unique and explores new scientific avenues, has novel hypotheses that will create new knowledge. And they are very explicit. If I'm a new investigator, and this applies to all of you, most likely I will explain how my project's research can refine, improve, or propose new application of an existing concept of method. So this is innovation of your proposal. This is fine. Less likely, so again, please do take these words of NIH with seriousness. I go for the other option described in the NIH definition, show how my research can shift the current paradigm. If I choose that path, I make a very strong case for challenging the existing paradigm, have data to support the innovative approach, have strong evidence that I can do the work. So not only your proposal has to be good, but also you as a PI and you as a team have to be good too. So with respect to how we write this section, again, this is a very short section, so we're gonna, in my view, it should consist of three different parts, three key essential parts. Keep in mind that the length of this section is approximately 0.3 to 2.5 pages of your formatting, which is font size 11 or 12 with 1-inch margins. So in these three parts, what you should do in part one, which not necessarily is supposed to be in this particular order, these parts can be in slightly different order, as we will see in some of the examples. In part one, you describe what is the current status quo in this field. What is the current state of the technology? Or the current method that you're trying to innovate on. So in case if you're building on your own previous work, which really refers to the renewals proposals, you will need to say that it's based on your own work. But in your case, because you're building on somebody else's work on the literature, you would really cite the previous work. And here you can also, again, restate differently what you're trying to address, which is the gap in the field, by diplomatically stating the limitations or shortcoming of the previous methods. You don't want to be saying something which may come very rude, especially to the person who will be the reviewer and maybe the founding father of a particular method. So be diplomatic in the description of the limitations. In part two, you describe the actual departure from the current status quo. You describe your innovation. You just describe how your new way of doing things is innovative. And one of the things that I find quite useful is you should also include the text "in our opinion," which really emphasizes two things. It emphasizes that this is your opinion. And again, it's important to state that this is your opinion because this is something new, something that is not established. And it also highlights that this is your idea, this is your innovation. So you can start this section with the text such as, the proposed research is innovative in our opinion because, and then you explain the reason why this is innovative. And part three, which is, again, may not necessarily come at the end, is kind of, is the positive impact of your innovations. So here, don't try to copy the things from the significant section, because here the positive impact is going to be slightly different. So in the significant section, when you discuss the positive impact of your research, it really relates to the core missions of the NIH, which could be tangible benefits, such as improving the state of the healthcare or dealing with a particular disease in general, and so on and so forth. So here you need to be focusing on the positive impact, which comes as a result from the departure from the status quo status quo in the particular field. And again, we will go through some of the examples to give you an example of how it actually looks in the actual proposal. So in terms of the organizational structure of your proposal, approach section, innovation section is again the second section, which comes after background and significance. So again, here we're using the organizational structure that Mary Kay uses, which I find actually quite nice, very well structured. So here, the innovation is its own whole separate part. So again, take this part, take this short section very seriously, because this is a criterion which is going to be judged on the study section. It's a very important yet short section. So here is an example of the proposal which comes from the NIH itself. It's posted on the NIH website. What I really want to go over here during the limited time that we have during our lecture is really to highlight the points which are related to the type of the structure that I was discussing, the key points, the key parts that you should be describing in your proposals too. So for example, the text in blue here, let's read it together. It says, this R01 renewal builds on the productivity and provide references 25 through 44 and foundational work of its predecessors, including important collaborations built with the NIH-funded clinical trial network during the original funding period. Overall, this application is highly innovative, so the keyword here, highly innovative, in leveraging 3 large funded HIV trials to extend our novel approach of assessing adherence and pharmacokinetics via hair levels to the next phase of HIV prevention research in a cost-effective manner. So these several sentences, they describe the fact that this work, which is discussed in the innovation, it builds on the previous knowledge and where it originates from. But it also hits on some of the other aspects. It hits on the aspects of assessing adherence and pharmacokinetics via hair levels in the next phase of HIV prevention research in a cost-effective manner. So it hits on these aspects of the benefits of the innovations of this proposal if this proposal were to come true. So these are not exactly tangible benefits, but these are very descriptive benefits related to the innovation. What I would also like to read, the text in green. So the text in green says, should help. So although rarely employed today, the incorporation of both short and long-term measures of adherence into oral PREP and vaginal PREP trials, the triangulation of these measures during the study analysis as proposed here should help assess patterns of adherence of PREP oral rings in Africa, e.g. daily at time of risk, multi-week holidays, which will be necessary to understand when designing precision public health interventions for HIV prevention. Finally, although hair concentrations and other pharmacological measures assess adherence, they also serve as measures of pharmacokinetics, which will be essential to incorporate during the investigation and rollout of injectable IRVs, especially at the end of the dosing intervals in the context of prevention. So here the researchers are really hitting on what would be kind of a positive impact of the innovations. Although, even though they're describing the innovation, so they're doing a nice job of blending the two parts into one kind of a thing. What they also do in the innovation section is something which I normally don't do, but they actually make a figure highlighting what the innovations are. And they also list what the innovations are, both in the text and in the figure. So I'm not inserting the figure here, but they clearly articulate what is the innovation 1, 2, 3, and 4. And again, in your case, you should do the same thing. You should have something which is very structured. Here's my innovation 1, 2, 3, 4, however many you're gonna have. So here's an example of one of the other proposals, which again comes from the NIH website. I'm not gonna go through this text in the interest of time, but I'm providing it to you in case if you would like to study this as an example before you start drafting your own. Finally, one of the advices that I'd like to give you is, again, go through these proposals, go through these examples, learn how these are structured, learn the techniques that the researchers use, and also use an example of our in-class activity, which I'm going to go to next. So today, again, in the interest of time, to allow you more time to spend during your breakout section to discuss your approach, instead of drafting something in class, I drafted this text beforehand. I drafted it in approximately 20 to 30 minutes to really use the strategy which I was describing earlier with 3 parts in order to apply this to the COVID-19 proposal that we were discussing. So my text here reads as follows. Detection of viral infection is currently performed with a real-time reverse transcription polymerase chain reaction, PCR test, for the qualitative detection of nucleic acid from SARS-CoV-2, I guess that's how it's spelled, in respiratory samples obtained from patients. This test lacks the speed and provides only quantitative information. Here we describe a new approach for SARS-CoV-2, which builds on previous extensive exploratory work for, I can't actually see that, for magnetic switching using functionalized paramagnetic nanoparticles. So again, what I'm doing here, I'm laying down the foundation for what is the current status of detecting coronavirus is currently, and I'm also trying to hit on the limitations of this method where I say lacks speed and provides quantitative information. And then I move on to the second part where I say the proposed research is innovative in our opinion because, and I provide the 3 innovations that I was able to come up with. The new approach builds on the indirect sensing of SARS-CoV-2 with sufficient sensitivity that obviates the requirement for multiplication of biological material. So here I'm doing really 2 things. I'm trying to describe what is the innovative aspect of our new approach, our new way of detecting coronavirus, but I'm also trying to kind of provide the benefit here that would come out of this. So again, the obviation for the multiplication of biological material is a positive thing, is something which is going to be welcomed. The new approach allows for quantification of viral load in a subject, which can be beneficial to the response of treatment monitoring. So here I have some misspelling, and overall patient care management. The test can, the test can be performed on a blood sample, allowing for seamless integration in the current state of care. So again, I'm describing the innovative aspects of our project. At the same time, I'm trying to describe the positive impact. You can do it either this way, or you can break it down in 3 parts. And then I'm wrapping up this section by saying the innovative test will enable ultra-fast, in parentheses, few minutes, quantitative blood test of SARS-CoV. So the difference here with respect to these tangible outcomes that I would actually be describing in the significant section, I'm not saying that this test is going to revolutionize the healthcare, that it will save human lives, Here I'm focusing on something which is directly related to the innovation. This is innovative test that will be ultra fast and will provide a quantitative blood test of SARS-CoV-19 CoV-2, and I should have added slightly more text with respect to how many particles I probably would be able to detect, so on and so forth. But this is a nice way to describe the innovation. So that's the end of my presentation for